Mr. Speaker. Mr. Speaker, a public fatality inquiry describes an elderly man with dementia dying on a weekend because he choked on a napkin, went into respiratory distress, and had a heart attack. Now, if he had choked on a Monday, he might still be alive because there would have been a full contingent of staff to help him. According to the inquiry's expert, staffing levels should not vary on the weekends and should be much greater than when this senior needed help. So, to the Premier, tell me again why decreasing staffing for frail seniors just to drive down costs is okay for this province.
Mr. Speaker, this is clearly beyond the pale. Staffing levels across Alberta are not reduced on weekends in continuing care facilities. Mr. Speaker, there are challenges across the country in recruiting sufficient staff for a growing number of citizens who require continuing care. But, Mr. Speaker, to suggest somehow on the basis of a report in 2010 about a very unfortunate situation that occurred with respect to a very specific set of circumstances is cause for widespread public concern is simply not fair to the residents, their families, or most importantly, the staff that care for them.
Thanks very much, Mr. Speaker. Well, I know staffing is less in this facility because I am there twice a week. And I read the notice by the elevator that talked about staffing changes. My heart skipped a beat this morning when I read that because the facility where this man died is the facility where my mother lives. So please, tell me and everyone else in Alberta that has someone, a family member in care, why are seniors paying such an awful price for being frail and for getting old in Alberta?
Mr. Speaker, with all due respect to the honourable member and her family's situation, I too know the facility very well in which this incident occurred. And, Mr. Speaker, I can tell you that as a result of the move to patient-based funding across this province, staffing levels in many facilities have increased over the last year and a half in order to meet the needs of their particular residents. Equally, and more recently, staffing levels have been adjusted downward in other facilities where the same level of care is not required for the residents in care at that particular point in time. Mr. Speaker, this is a system that we watch closely. We believe it reflects a good intent and policy on the part of Alberta Health Services to allocate staffing resources appropriately.
Honourable member.
Thanks very much, Mr. Speaker. Well, given that, on March 11th, I said the government was playing a game of risk and timing with seniors in long-term care because staff ratios are important, particularly at night or on weekends when people get sick, throw up, and can't turn over because then they choke. So how is this honouring our parents, our elders?
Mr. Speaker, a system that allocates resources based on specific needs of residents at a specific point in time is a system that is supporting residents and families and communities. And, Mr. Speaker, again, to make generalizations about our continuing care system on the basis of a specific incident that took place 3 years ago is simply not an accurate reflection, Mr. Speaker, of the excellent work that is going into continuing care across the province today.